education video series, and my today video is about checking your blood sugar at home. Why do I need to check my blood sugar? How do I check my blood sugar? What should my blood sugar level be, and when should I call the doctor? These are certain questions which need to be answered. Why do I need to check my blood sugar? If you have diabetes and your blood sugar level gets too high or too low, it can cause problems. Many people with diabetes need to know how and when to check their blood sugar levels. Glucose is another word for sugar. You might need to check your blood glucose to know how much insulin to give yourself if you use insulin. Help you plan your meals, snacks, and exercise. Know how your diabetes medicines are working. Your doctor and nurse will tell you how often and at what times of day to check your blood sugar. People who use two different types of insulin, like basal and mealtime, need to check their blood sugar at least 4 times a day, including before each meal and at bedtime. You will need to track your rhythms over time. This will help you keep your diabetes under control. How do I check my blood sugar? There are 2 ways to check your blood sugar level. One involves using the blood glucose meter to test a drop of your blood. The other involves wearing a continuous glucose monitoring or a CGM device that checks the level for you. Your device will come with specific directions. Read these carefully to make sure that you know how to use it correctly with all the general steps involved. To use a blood glucose meter, wash your hands with soap and water, then dry them. Get your meter ready, put a new strip in it, choose the finger you will prick. Try not to use the same finger every time. You might also be able to prick other places, such as your forearm. Your doctor and nurse will tell you if you can do this. Use a very small needle or lancet to prick the side of your fingertip, and you will need a sharp stick and little discomfort. To get a drop of blood, you might have to squeeze your finger to get the drop. Touch the edge of the test strip to the drop of blood, and the meter will show your blood sugar level. Write this down so you can share it with your doctor or nurse. Throw the needle away in a special container, which is meant for this. Now, the CGM device checks your blood sugar level automatically. They measure the sugar in the fluid under your skin rather than in your blood. And these are most often used by people who take multiple insulin doses each day or use an insulin pump. To use a CGM device, you need a sensor, transmitter, and reader. Now, the sensor goes under the skin of your belly or arm and is usually changed every 7 to 14 days, depending on which device you have. One sensor can last up to 90 days. The transmitter goes on your skin over the sensor, held in a place with a sticky page. Now, the reader can be a small recording device, a smartphone app. The sensor measures your sugar level, and the transmitter sends the information to the recording device or your phone. You can attach the recording device to your clothing, carry it in a purse or bag, or place it near you. With some CGM devices, you can see your sugar level in the real time and share them with family members or your doctor or nurse. With other devices, you periodically hold your smartphones or the sensor to see your sugar level. Now, what should my blood sugar level be? Your doctor or nurse will talk to you about your goals, including what level is normal for you, what is too high, and what is too low. They will also tell you what to do if your blood level is too low or too high. In general, low blood sugar is treated by eating a quick source of sugar. In an emergency, if you can't eat or drink, it can also be treated with a dose of hormone called glucagon. High blood sugar is treated with insulin or other medicines, and your doctor might tell you to test your urine for ketones if your blood sugar measurement is high. Ketones are chemicals that can build up in the blood when sugar levels get too high based on the results. They might make changes to your medicines, diets, or exercise plan. When should I call the doctor? Call if you have any question about how or when to check your blood sugar. And if you are not sure what to do about the results, your doctor will help you. If you have symptoms of low blood sugar, this includes sweating, shaking, hunger, and feeling worried. And symptoms of high blood sugar, These include intense thirst, feeling very tired, urinating often, and breathless and blurred vision. Thank you.